everybody. My name is Diane. I'm a dentist with a master and doctorate in the field of laser. And today I'm here to present the first webinar from Sumus Medical Laser, the benefits of photobiomodulation for patients. And well, little bit of history. Just soon after the first laser was assembled by Maiman in 1964, the first study involving the use of laser in dentistry was carried out by Stern and Soganais. But it was after 1967 that Master and his group showed the first work using laser in low intensity, which initiated the age of photobiomodulation. Photobiomodulation is not a new tool. From the light comes everything that exists in the planet, and light is our primary source of energy. And with the evolution of the technology, we can now place this energy source inside a handpiece with high penetration and efficiency to promote cellular and systemic homeostasis. If I could summarize it in just one word, what photobiomodulation is, this word would be cell nutrition. No, not a drug with expected side effect, not an alternative holistic treatment. It is pure physics, light energy that can be absorbed and transformed into chemical energy. Let's go inside the laser field in dentistry. The laser field in dentistry can be divided in two major areas. Photobiomodulation, which generates photochemical effects, and high power laser, which generates deleterious photothermal effects. For example, laser surgery, ablation, and tissue removal by vaporization. When we work with therapeutic laser, we seek some macro effects, reducing signs and symptoms of inflammation and as reducing pain, reducing edema, reducing local temperature, reducing erythema. Also, that laser accelerates cell and tissue regeneration and accelerate function restoration after an injury. I used to compare laser in dentistry with extra wings, which take us much more than where we could have to go. So let's understand more about this tool. First of all, it's important to understand that the wavelength that we use in dentistry, it's totally safe. Red and infrared do not cause any damage. We use light that are in the visible and infrared spectrum, away from ionizing radiation. And of course, we need always use protective goggles. The only danger of light is into the eyes. How photobiomodulations work? Let's see. An important first thing is to have cellular need. That is, the tissue or cell must be damaged under oxidative stress. The patients with systemic disease, chronic or acute localized injury, post-trauma, vascular or nervous tissue alterations. In dentistry, some examples would be the presence of lesions such as aphthous ulcers or lichen plane or xerostonia or postoperative surgery or any inflammation pain. The second thing is that there must be cellular absorption for the effects to happen. The absorption of light by chromophores leads to the transformation of energy into chemical energy, which is the principle of photochemistry. Or like, for example, the photosynthesis. In these two graphics right here, we can see the main chromophore. Some mitochondrials like cytochrome C oxidase and flavins, porphyrins of cell membrane, enzymes, skin melanin, oxyhemoglobin and deoxyhemoglobin, and water. Those are the main products or substances that can absorb the light from laser. And here's the summary. Energy absorption by chromophores, chemical reactions, cascade, nuclear response, and the consequential cellular and systemic homeostasis. In dentistry, we work with different tissue: skin, bone, muscles, nerve tissue, mucosa, glands, and it's necessary to act with different wavelengths. And this is the great benefits of Horizon Laser, which offers 4 wavelengths, giving us an incredible tool to work in dentistry. Here are the 4 wavelengths: 650, 810, 915, 980. The combinations and simultaneous use of the different wavelengths provide superficial and deep tissue regeneration. 650, better for melanin, blood binding oxygen. 810, better for enzymes, deep healing. 915, also oxygen release. 980, water. So all this together makes the best clinical practice. And here, another graph, we can see the water, hemoglobin, and melanin spectrum, and also the 4 wavelength that Horizon Laser works. Also, the number 3, it's necessary to give a break to the tissue and allow secondary cell signaling pathways in accordance with the genetics and physiology of irradiating tissue. We usually wait 24 hours for a new session, and many treatments can be weekly. This will depend on the type of the tissue, metabolic rate, and symptoms. For example, painful injuries are done daily to provide comfort to the patient. Nerve regeneration is slower and weekly sessions are better. And the number 4 are the clinical results that can be direct on the cells, act on the biological tissue as a whole, modulation the inflammatory process, and vascular action, local vascular and lymphatic regeneration. And we have now many articles in the literature that supports the use of photobiomodulation in dentistry. Many book chapters, especially this one, where our group published all the applicabilities and protocols of laser in dentistry. And the question is, how can photobiomodulation help in my clinical practice? Photobiomodulation has benefits for all dental specialties. As you can see in this graph, taken from the software of the Horizon Laser. No matter your area, photobiomodulation will bring benefits. So dentistry, oral surgery, periodontics, oral pathology, maxillofacial. So all areas have applicabilities. Do you know, the main question that we have always to ask, do you know what matters to your patient? And your patient wants the best technical treatment, but she's not able to measure your technical performance. What matters to her is to receive a treatment that, in her perception, brings more comfort, less invasive treatments, have access to treatments that have improved results, fast and healing, new solutions to problems that until then had only palliative treatments. And of course, perform treatments with less use of medications. So this is what your patients want. So we need to give them this kind of feeling. And speed with healing, the healing time is accelerated. The patient returns from a post-operative period more quickly and with better quality. So we can see here in 48 hours, the best benefits of healing after extraction of a third molar. You can just take it out the suture. Also, other examples in daily clinical practice include ulcers, herpes, and minor trauma. Few seconds of irradiation and the results are fantastic. Laser therapy treats pains and avoid or minimize the use of medications. Common cases such as pain in temporomandibular joint, trigeminal neuralgia, dentin hypersensitivity, and muscular pain are very well managed with help of laser therapy. But let's talk about pain management. One of the most popular topics with phototherapy, it is pain. Didactically, we divide it in two groups. The first occurs via blocking the action potential of the nerve cell, as postulated by Shaw in 2007. And this block requires a high dose of light and has immediately but reversible action. The effect of immediately analgesia brings comfort to the patient, and it is fundamental tool in the treatment of TMD, trismo, neuralgia, torticollis, and trigger points. The long-lasting analgesia are the number 2 and 3. The number 2, the analgesia is via reduction of inflammatory process, reducing the inflammatory cytokines and reducing the stimulation of the local nociceptive neurons that are stimulated by these cytokines during inflammation. And the third via is analgesia by regeneration of injured nerve tissue that cause neuropathic pain and makes treatment difficult to resolve. So nerve regeneration, real and durable treatment, inflammation treated locally, drug-free treatment, immediately analgesia, all this together makes the laser a good tool for pain management. And TMG is one of the main topic of these effects and also one of the most studied and performed treatments in the clinical practice of phototherapy and dentistry. Many studies about this topic have been published. And this one, this is the most recent systematic review with meta-analysis, revealed positive effect of laser on pain relief. A total of 31 studies were included, and they suggest that the laser efficiently relieves pain and improves functional outcomes in patients with TMD. And laser has been seen as a complementary option for the treatment of TMD. And this is due to its analgesic, anti-inflammatory, regenerative effects with no reported adverse effects, good acceptance by patients, and of course, pain reduction contributes to improved jaw motion, chewing, and masticatory performance. Also, we can treat trigeminal neuralgia, and laser has been used as an alternative treatment for pain control, especially when the patient does not respond to drug treatment or it is recurrent despite surgery. Here's some literature about this. And in dentin hypersensitivity, unlike products and techniques for treatment of dentin hypersensitivity, sealing dentinal tubules, laser therapy will act directly on the pulp tissue, stimulating the formation of reactive dentin and definitively sealing the tubules. So this is the main differential of doing laser or treating the tubules outside in. Here a little bit of literature also about this topic. And how about an experience of getting out of surgery without complications? Laser therapy promotes a postoperative period with greater comfort, absence of minimal pain, edema, hematoma, a truly different experience from the conventional one. So we should give this opportunity to our patients. This is our differential. Another great applicability of laser is in the surgery for sure. And here we can topic some benefits: reduces, avoids use of analgesic and anti-inflammatory drugs, reduces regeneration time, improves local tissue and vascular quality, reduces pain, reduces edema. And I bring here some videos to show you what happened just after a surgery of implants. This first video was recorded immediately after surgery, total maxillary implant protocol. And I asked her where it hurts, and she's showing me now. Notice how the patient's movement is restricted, shows pain in speech and movement. Now the second video was recorded after the laser application. I asked if she's okay. She said yes. I asked if she still feel those pain, and she said no. I asked if that area of the lip feels pain. She said minimum to minimum. I asked if the speech is normal, and she said it looks like her mouth fell. In fact, it's the sensation of anesthesia. And notice now how your mouth and face move better, showing the immediate effects of laser. So this is a real practice after implant surgery. And here the immediate results of mouth opening after irradiation. So we do some laser application in the TMJ area and also in the muscles. And just after the laser, the patients can open better the mouth. In the treatment of edema, we can see nice results too. And when we do the laser just after the surgery, we can see the laser avoiding the edema. So the anti-inflammatory and stimulatory effects of the laser on local microcirculation and the lymph nodes allow the reduction of installed edema. So now we can treat the laser before the edema appear, or avoiding the edema just after the surgery, or we can treat the installed edema after 48 hours from the surgery when the patient appears like in this picture. In fact, lymphatic irradiation is one of my expertise because I did my PhD with that, and here the publication. The results of my PhD showed that laser light activate defense cells before injury occurs, resulting in lower inflammatory after injury. Laser can stimulate lymph nodes directly where defense cells are made. And laser therapy prevents edema when prophylactically carried out on lymph node. I worked with mice, and I did injury with carrageenan in the mice paw, and doing laser 1 hour before this injection of carrageenan, I saw no edema formation. So it was a very nice result. And also we earned a prize in 2008 in a World Conference in South Africa. Well, how about a light tool for antimicrobial action? This is another great area of photobiomodulation that have no side effects, local action, prevents or reduces the use of antibiotics, helps speed up the healing process, and is totally safe of use. This is the photodynamic therapy, PDT, and is a local technique, local antimicrobial action, avoiding reduction the using of systemic antibiotics, and providing another nice experience for the patients. We can treat also gingival inflammation, and also you can use this technique for endodontics, solving root infection situations that are difficult to solve with conventional technique. So PDT consists of the use of a non-toxic, light-sensitive photosensitizer, for example, blue methylene, and that this photosensitizer are activated by light, and the result is the generation of reacting oxygen species that cause the death of microorganisms. So by chemical effect, an oxidative damage. The PDT technique also have a lot of benefits, including being harmful for microorganisms, but it does not harm human cells. Broad spectrum of action, you can see fungus, bacteria, parasite, virus, is efficient phototoxicity against bacterial spores and virulence factors, and absence of microbial strain resistance to photodynamic treatment. Signs, the ROS, the oxygen species, reactive species, reacts with the nearly all biomolecules. PDT also offers a powerful multi-target method to avoid selection of drug-resistant strain. So it's a very nice technique, very simple to do, and very cheap too. In dentistry, there are many applications of the PDT. Sinus infection is a common cause of many oral pathology, like herpes simplex, endodontic treatment, candidosis, cavities, peri-implantitis, periodontal disease, and many other applications that we can use the photodynamic therapy. Here, a very nice and just published work, 2012, May 2012. PDT can provide effective therapeutic protocols for a very broad spectrum of pathogens. And this study represents a very important step to bring PDT closer to implementation into mainstream medical practice. And in dentistry, at least in Brazil, we use PDT in a everyday practice. It's very established technique with very nice results. So also laser can bring more solution for your from your practice. Here, another situation that you can use laser, like nerve tissue regeneration, paresthesias, facial paralysis, trigeminal neuralgia, that have a very nice success. And usually we didn't have any tools to treat this kind of pathology. Also, we can do a resolution of inflammation without anti-inflammatory. And this modulation of inflammation benefits many pathologies in the dental clinic, avoiding the use of medication. We can provide less traumatic option for children, and we can treat children's stomatite. We can do the contamination of cavities. Is an option for the elderly. Prosthesis candidiasis, stomatitis, burning mouth, lack of saliva, and many other solutions are obtained with the laser. Also, we can prevent recurrent injuries, like do you have aphthous or herpes? And do you know that laser can prevent this kind of lesions? This is a nice treatment that we can offer also for our patients. And we also can manage the oncohematological patients. Here is a big field of action. Laser therapy brings many benefits to cancer patients by treating and preventing many side effects of oncology treatment. And among these effects are oral mucositis, fibrosis, lack of saliva, lack of taste, pain and swelling, and much more. We know that laser is the only treatment that really treats and prevents oral mucositis. And this is a mask recommendation internationally. So it's a big field of laser for us dentists. Also, I did a list here of 12 new areas that we can include in our everyday practice with the laser. Like I said, prevention and treatment of oral mucositis, facial paralysis, trigeminal neuralgia, the contamination by the PDT, the photodynamic therapy, child stomatitis, lip herpes, mouth ulcers, paresthesias, salivary gland regeneration, treatment of dysgeusia, and treatment of pain and edema without medication. Also, another nice field is halitosis. And we use the PDT techniques to decontaminate the tongue to improve the results of the halitosis treatment. It's a very nice and new treatment that we are doing here in Brazil with great benefits to our patients. And how about improve your money? Providing what your patient expect. This is the best combination. Nice treatments and happy patients. So here are the state of art of dentist phototherapy, the Horizon laser. And this equipment have a complete clinical guide software inside. And we can have this step-by-step how to treat the patient is just amazing. We have different clinical approach, is a complete treatment, intraoral irradiation, extraoral, lymphatics, nerve tissue path, systemic irradiation. So all these together inside a very nice software in a video motion. So for example, here, the step-by-step, so you treat soft tissue, hard tissue, nerve tissue, and the equipment leads you where you should irradiate and for how long time. Also, we have some explanations about what tip to use in each clinical situation. So we have large tip application, or for intraoral, we use the small one. So we can go inside the mouth and treat the inside injury. And also video tutorials are available to professionals, so you can study a little bit and watch the video to know how to do the laser application in your patient. And here in this video, I'm doing a demonstration of irradiation of the lymphatic chain and the TMJ that can be used to prevent or treat edema or pain in the situation of installed infection or TMJ pain. So it's a very nice equipment with the tutorials inside that leads you to the best treatment of photobiomodulation. And concluding, with the laser, patients use less analgesic and anti-inflammatory drugs. In all areas of dentistry practice, professionals can offer their patients the differential of performing a procedure with more comfort, less pain, better quality of tissue regeneration. The professionals has new treatments to offer to his patient, like I told you. The experience is in the post-operative period changes completely. More comfort, mild symptoms, normal life after surgery, and of course, taking all necessary and recommended care. The patients become more confident with the professional. The patients recommend the professional to his network with more emphasis and feeling of gratitude. So this is very nice equipment and technical, how can I say, tool that you should have in your office. And like in my office, I only do laser. So it's kind of my life, my job, my main job, using laser. And all my patients are very happy with the results and indicate new patients. And the best thing is we give to the patients what they really need and concern about. We give them comfort. We give them less pain. And this is amazing. So thank you very much for your attention. Here's my contacts.